Take a few minutes today to be very direct and candid about something personal and political. In early December, after about a year of irregular periods and checkups with both my doctor and my gynecologist, I had a cervical biopsy done in office. The results showed irregularities, which led to a hysteroscopy and a D&C. The tissue was sent to pathology. The results came back as stage 1 uterine cancer. I had my first ever CT scan and everything came back clear. There's no indication that the cancer has spread, and I am grateful for that. I'm also clear-eyed about why that matters so much, because early detection saves lives, and access to routine screenings determines who gets it. The diagnosis is not a resignation, it is not a retreat, it is a medical interruption, and I intend to move through it and get back to work. I do want to talk about why I'm being fully transparent about this, from diagnosis to treatment to side effects to cost. The irony of being elected because my predecessor passed away from this horrible disease is not lost on me. Ignoring the environment that Senator DeWitt and I shared is a disservice to our constituents. Silence is what perpetuates bad systems. We live in Iowa, unfortunately the cancer capital of the country, and yet we continue to tolerate policies that make early detection harder, treatment more expensive, and recovery more precarious. We moralize illness, we nickel and dime care, and then act shocked when outcomes are worse. This diagnosis did not come out of nowhere for me. Given my family history and the environment in which I live, it felt less like a remote possibility and more like a foregone conclusion. Every provider I've met with has said, "You're so young," while scrolling through my chart. And I think what they really mean underneath that is, how does this keep happening? I am not interested in pretending this is just a private medical matter. It is a public policy failure playing out in my body. I'm going to be transparent, not because I owe anyone my vulnerability, but because sunlight is a tool, and I intend to use every tool available to me. I will share what treatment looks like, what recovery looks like, what it costs, what insurance covers, and what it doesn't. Silence is how bad systems survive. I appreciate accommodations where they're necessary, but do not mistake this diagnosis for weakness. My first priority after beating this horrible disease will be taking care of my constituents in Senate District 1. I will be available as available as I am now. I want them to know what care and a treatment plan can look like, and what hopefully the other end of this diagnosis can look like. I'll be back ready to continue the important work at hand. Thank you.